Our next here speaker will be Dr. Newnyard, that we are thrilled to have here. And as you know, and I wanted to give her affiliation to you. She's the Assistant Director for Academic Service in Ramathwadi School of Nursing, Faculty of Medicine. And she's actually one of the most well-known guests that we have here in Thailand and in her country. She has worked a lot in different fields of research. Thank you very much, Dr. Nimyar. Do you have my voice?
Yes, I do. Good evening, everyone.
Good evening. Yeah. You can have the rest. We'll
Can you
already
hear me very well? Okay, great. Thank you. I would like to start by expressing my gratitude to Tulane University on the clinical subject antibiotic resistance. All right, let me share my slide. Hope it's work. Okay. All right, hold on. Let me hold a little bit. So it's shown on the slide, on the screen.
See your slides. Can you hear us?
I can see that, right? Yes, I do. Yes. Do you hear me?
Yes, we hear you perfectly.
Good, perfect. All right, so I'm gonna start with the first slide. So you can see that for the antibiotic resistance, the World Health Organization actually has recognized antibiotic resistance as one of the top 10 global and both the National Institute for Health and Care Excellence and Public England classified as a public agency. So also is vice.
Dear Dr. Nyong'yar, I'm sorry for interrupting you.
Look, we can see that there is a wide
Can you
range
hear
of
me?
serious consequences. So antibiotic can mask symptoms, make it safe. Yeah.
Sorry for interrupting you, but unfortunately there is a connection problem. Yeah, I would be appreciate if you could turn off your camera for the better quality of the connection. So unfortunately, we had a connection problem with Dr. Nyong'yar. As soon as we have her, we're going to continue the program. So Dr. Nyong'yar, you're given the co-host permission. So you're permitted to share your screen and your voice with us.
Yes.
So the system allows you now. Is everything all right? If not, I'm going to support it with the team.
All right, let me try and share it again.
I would appreciate it.
How is it? Can you see that?
Yes, perfect. We have your slides.
All right,
Very perfect. Thank you.
okay, I'm gonna turn off my camera then. I think it's maybe some issue with this. Okay.
Okay, thank you.
Good. I may go fast. I'm not sure, if it's, the connection is disappear again. All right, we already talked about why antibiotic resistance is so big deal. And I already mentioned that, antibiotic does one work, no longer work due leading to treatment failures and prolonged illness. And as bacteria evolve, they become resistant to more and more drugs, which means fewer treatment options for our patients. And in order to manage resistant infection, we often need more expensive drugs, which rise healthcare costs for everyone. And antibiotic resistance can lead to serious adverse drug events, including life-threatening complication and even death. So this is why addressing antibiotic resistance is so critical, not only for individual health, but for the health of community around the world. So as we already know, antibiotics are medicine that help prevent and this You still hear me? Sorry about that.
That's okay, I understand. There are always connection problems and in virtual events that's completely natural. Are you okay now? Is everything all right? Can we continue? So as you see, unfortunately, we have some connection problems. We should wait for her. We're going to wait for her for about 3 to 5 minutes. If she could join us, that would be nice, and we're going to continue. And if not, we have to go to our next speaker. So thank you, audience, for your patience. So now that we have time until our guest is going to be back, I would like to tell you that 2 days later in my country is a tradition called Geldo. This is completely connected to nature and a planet, changing of seasons. Yalda night is the longest night of the year, and because of that, we're going to celebrate it with delicious food and so on. So I would like to play a video for you that you're gonna be get familiar with that. So
Dear guest, I would like to share our missions and visions in Tehran University regarding planetary health. So I think, uh, can you hear us, Dr. Atsapon?
Yes. Yes, I'm back. Did you hear me?
Yes, we hear you perfectly. Could you please continue?
All right. All right, sure. I'm gonna try and go faster because I'm not sure if it's going to happen again. Hopefully it's okay. Let me share my slide again. Sorry about that.
That's not a problem. We can try again.
Okay, sure. I'm gonna turn my video off so that it's not going to, intervene the connection. All right. So I think we stopped at this slide that I mentioned. In 2019, we estimate that 1.27 million deaths were linked to antibiotic-resistant infection, and it's estimated that by 2050, antibiotic resistance could reach to 50 million deaths each year and add an extra 1 trillion in healthcare costs globally. So to help you understand just how serious that is, so we consider that 50 million deaths would be more than the total number of people who die from cardiovascular disease, cancers, respiratory disease, and diabetes and kidney disease combined. So this is why addressing antibiotic resistance is so urgent. And if we don't take action now, this could catastrophic consequences for global health. So when we take a look at, now we understand how serious antibiotic resistance is, let's take a look at who it affects and why it's such widespread issue. So antibiotic resistance doesn't just affect one part of the world. It's a problem in countries across all regions and at every income country. However, it's worsened by factors like poverty and inequality. In fact, low and middle income countries are the most affected. as the widespread often inappropriate use of antibiotic in human, animal, and crops. The inappropriate management of pharmaceuticals at the site of production is a key driver of antibiotic resistance, and self-medication with antibiotic is increased so common. So over 50% of antibiotics are purchased without prescription globally. So the combination of poor hygiene and sanitation, also along with limited access to essential healthcare services, is also an issue. So insufficient infection control measures and inadequate healthcare staffing can actually further promote the spread of antibiotic resistance. So we know that everything's happening now, antibiotic resistant, it affects people, it affects the healthcare system, but the question is, how should we react it? So in 2015, the World Health Assembly created a global action plan to fight rising awareness through effective communications, education, and training, improving knowledge through research and monitoring, preventing infection to reduce the spread, reducing the use of antibiotics in both human and animals, and increasing investment in new medicines, vaccines, and diagnostic tools. So why these steps are essential in combating antibiotic resistance? There are other factors related to it and require our attention. So you can take a look at so many factors that actually increase antibiotic resistance. For example, misuse and overuse of antibiotics, inadequate knowledge, low awareness, prescribe antibiotics improperly, global travel, lack of proper education and training. So for the prescribed antibiotic improperly, healthcare providers may sometimes prescribe antibiotic incorrectly because of factors like their own clinical experience, uncertainty about diagnosis, patient pressures, and concern about possible negative outcome. So in several countries, including Thailand, the percentages of antibiotic use without prescription is notably high, ranging from 30 to 52%. And the general public can access antibiotics without a prescription. When we think about the knowledge, the World Health Organization reports that 26% of the public in 12 countries has misconception about antibiotic resistance, and poor knowledge concerning appropriate antibiotic use influence the misuse of antibiotics. The prescribed antibiotic improperly, I already mentioned about that. And when we lack of awareness of antibiotic resistance, is associated with higher antibiotic misuse. The interesting about global travel is that the three most frequently identified risk factors are the travel destinations, the use of antibiotic during travel, and the occurrence of traveler diarrhea. E. coli is the most common infection among travelers. In the Southeast Asia, South Asia, and North Africa are the high-risk areas for antibiotic resistance. A lack of antibiotic-resistant knowledge can actually result in misconceptions, which can lead to misuse and overuse of antibiotics, resulting in antibiotic resistance, and individuals may fail to recognize when antibiotics are necessary or used because of the lack of antibiotic knowledge. And healthcare professionals who may not be trained well or have the best practice for antibiotic use can cause antibiotic resistance as well. This is actually in the front lines of patient care in combating antibiotics, as they mostly work, closely and directly with the patients. They are the one that, can talk to the doctor what medication appropriate, the dosage, the route that appropriate for the patients. Their roles in identifying and managing infections early can actually help reduce the spread of resistance of the bacteria. We are very, familiar with the roles of the nurses. For example, administering antibiotic, monitoring adverse side effects, managing with other discipline teams, educating patient and family members on proper use of antibiotic, and prescribing antibiotic, in some countries that they authorize the nurse to do so, and preventing the emergence and spread of antibiotic to antimicrobial stewardship. Traditionally, the nurse in antibiotic resistant stewardship actually focus on clinical, including ensuring the biological sample, administer antibiotic, inform patients and family to ensure that they have antibiotic the right dose, right time, and they're able to take antibiotic on the discharge properly. The emergence of antibiotic stewardship nursing now include non-clinical nurse as well, especially for the leaderships in MS initiative, contribution to research in antibiotic and stewardship, and involvement in policy development, and also participation in the implementation and evolutions of MS program. This is just a general definitions of the AMR. You know, some people use antibiotic resistant and they use antimicrobial resistant interchangeably, but you know, it's actually totally different. When we think about AMR, it occurs when bacterial, virus, parasites, or fungi become resistant to previous effective treatment. And the term of the MS was not new. It actually was introduced in the scientific literature in 1996. It refers to a coordinated approach for proper use antimicrobial to preserve their effectiveness. And actually, when we think about successful MS programs, it involves improving clinical practice, educating healthcare professionals and the public, monitoring antibiotic use, and enforcing health policies. Successful MS can help reduce MR growth, leading to fewer infections, lower mortalities, and reduce healthcare costs globally. According to Joint Commissions in 2017, initiating MS standards in all organizations is one of the top priorities, and the WHO considers MS as one of the 3 pillars of an integrating approach to strengthen health system in order to improve patients' outcome and quality of care, patient safety, and treatment failure reduction. So when we think about antimicrobial resistance stewardship, it needs to have some factors that can help to success. For example, adequate knowledge, sufficient training on antibiotic resistance, collaboration between healthcare providers, organizations, between institutions in the small or the larger scale, the infection prevention control or the IPC nurse specialists, and also include the non-specialist nurse as a coordination of patients in antibiotic resistance and in the stewardship. A lot of literature say that nurses are not engaged well in the MS. And if we take a look back, even nowadays, MS had traditionally been the domains of physicians and pharmacists. And the role of nurses is infrequently specified in the guideline from the official bodies such as the NIST. So there's a wide gap in knowledge such as the concept of MS, knowledge of microbiology, and use of various antibiotics. Many nurses perceive they are not vital parts of the MS, and their perceptions of medical hierarchy is also a major barrier to their active involvement in MS as well. Other barriers include increased workload, lack of medical team support, low confidence, competency issue, limited resources, time constraint, and lack of confidence in their opinion. You can say that nurses work so hard and they have so many important roles in stewardship activity. For example, monitor and communicate daily patient progress with other multidisciplinary team. The results are coordinated by the nurse and communicate to treating physicians. The nurse monitor and report to the physicians and pharmacists any adverse event, including diarrhea and other adverse effects. And they actually view the patient clinical status and change in medications. They review cultures and sensitivity results and report any mismatch, timeout, and antibody de-escalation. So they mostly closely monitor patient responses and initiate appropriate change, to the doctor as well. So this is just some light, how nurses work in terms of stewardship. In order to be able to competent, they need to get trained, and they need to get support from the nurse leader and the researcher. They need to monitor and assess other nurses as well. They need to learn about infection prevention and incorporate stewardship into day-to-day practice and communicate with nurses in other institutions. And the roles for the patients, they need to educate and train patients and family members to ensure that those people understand about antibiotic and how to take it. I think this is my last slide for the conclusion, that we believe that antibiotic pose a significant public health concerns, and nurse play a crucial role in addressing antibiotic resistance because the education, they raise awareness, they control and monitors antibiotic resistance, and they work closely with the patients and other healthcare providers. So this all important for the nurse, in preventing the spread of antibiotic resistance and ensuring that more effective management of infection should be considered. I think that's it for my presentation. Sorry, I tried to go fast because I'm not sure if it's going to disconnect or cut me off again.
Thank you very much, Dr. Newmark. That was a very, very good speech, and I used a lot of it. A lot of information can be useful as a nurse in practice, especially in critical units and especially in units like ICU. That can be very useful for us when caring for patients which have complicated issues, are very, very sick, and as end stage patients especially. These kind of informations can be very useful to us. I have two questions from you. If you have the time,
Okay.
I will be very happy to hear
Sure.
the answers from you. First thing is some of the microorganisms that can cause severe infections in patients that are actually antibiotic resistant and are not sensitive to many antibiotics are antibiotics like MRSA or like Acinetobacter, and these kind of microorganisms are very, very resistant. New kinds of these microorganisms, like new types of MRSA, are even resistant to antibiotics like vancomycin. And the fear in low-income countries is that if these kind of microorganisms can get resistance even to strong antibiotics like colistin, then what we can do, we will lose a lot of patients because of the hospital-acquired infection, and this can be devastating, especially in low-income countries. As you know, the ICU and critical care units are not that much hygiened and are not actually disinfected properly. So what is your suggestions about this matter? And if you can answer this, I'll ask my second question after you, please.
Thank you so much for your questions. It's a great questions, and even in Thailand, it's happening right now. When we walk through the floor, a lot of MRSA, vancomycin, because in Thailand, it's open warded. We don't have separate room for the patients. One patient get infection or MRSA, another one, have high potential to get it. Mostly in Thailand, what we do, we try to do the isolation, precaution, and the nurses mostly play important role to do that. We monitor each others, and we actually monitor the doctor and all the nursing students, all the medical doctor who enter the ward and work with the patient. We need to ensure that the 100% they follow the protocols and they not, get spread, infection or the contact precaution to other patient, even go back to the homes or the apartment. This needs to be closely monitored. Yeah. Mostly they have the policy or the protocol, let's say very simple, hand hygiene, 7 technique, the process that need to be followed, something like that. Yeah.
Thank you very much. As you just said, we do the isolation in Iran too. We isolate the patient, but sometimes when there is a microorganism like Shigella or MRSA that is resistant to antibiotic, we always fear that other patients might get the respiratory infection too. This happens a lot because we don't have timely diagnosis of these kind of microorganisms that are resistant to the antibiotics, especially in cases of MRSA and Acinetobacter. Sometimes we are facing like 10 patients who have MRSA and 10 patients who have Acinetobacter, and they are not sensitive to any antibiotics aside from the colistin. And as you know, as a physician, Acinetobacter can be very resistant, and colistin is a very powerful and potent antibiotic which can affect the renal function and hepatic function of these patients. So these kind of end-stage patients that are at the end of their lives and are very complicated, very costly for the healthcare system, and sometimes treating them can cause further microorganism resistant, because as you know, when microorganisms transport their DNA and we can't destroy it completely with our immune system, this can actually facilitate the development of new resistant microorganisms. And this is what we fear in low-income countries, that treating these kind of patients, end stage complicated patients, can actually cause further microorganism resistant, further bacterial resistance. And we don't know how to actually treat with this. We don't know what can we do against this, and how can we actually facilitate the timely diagnosis of these patients. How can we understand which patient is at the risk of getting infected with resistant microorganisms, because this can help a lot. And as you know, the situation for doing the PCR test can be very costly for the patient, especially the patients that are inpatient in private hospitals. PCR tests are very costly and can be complicated to, especially in a country like Iran, which we have shortage in a lot of our instrument, in a lot of our tools that we use for our tests and for our laboratories. So what is your suggestion in this matter?
I would say that we need to be proactive on what we are doing with the patients.
Dr. Nimyar, do you have my voice?
I mean, like, if we have the patient, let's say, get the folic. Yes. Do you hear me?
Okay. I think there was a connection problem.
Yeah, maybe I just mentioned that we need to be like more proactive. We need to start detect the patient earlier, whether the patients have, let's say, the central line, they have the Foley catheters. We need to have the team that keep monitor the patients and be able to capture what's happening before there's infections get severe and get progress, and we're not able to prevent it. And basically, again, we go back to the basic preventions and infection in the ward, especially in the ward in Thailand.
Thank you very much, Dr. Nimyard. It was a very, very good speech, very informative speech. And it was very, very fruitful for us as nurses, especially nurses that are working in practice, and other healthcare workers especially used it. I know that these kind of information are very useful and can give us insight of the future of healthcare systems and what kind of complications and problems will they deal with. Thank you very much.
Thank you so much for having me
invite
today.
our other moderator, Ms. Bluka, to continue with the program. Thank you.
Thank you.
Thanks a lot. It was really informative. Thank you both. So as I told you, we're going to talk a little bit about Yalda night, which is the darkest and longest night of the year. And it's a tradition in my country and some other countries, like Armenia, Azerbaijan, Tajikistan, etc., that people are going to celebrate that. They want to be together, to spend the longest night together with their beloved ones, with some delicious food and etc. So this is, I mean, the philosophy behind this night is really captivating. So this night is going to be the longest night, and after that we're going to have the summer back, and again the length of the days are going to extend. So this is the victory of light to darkness. So I want to show you a video about this. This is going to be much more informative than I talked about. So I'd like to invite you to watch this video.
or Chile, is an Iranian festival celebrated on the longest and darkest night of the year. Every year, on December 21st, Iranians celebrate the arrival of winter, the renewal of the sun, and the victory of light over darkness. Yalda Night, the birth of the sun, proves the value and importance of the sun among ancient Iranians. Afghanistan, Tajikistan, Uzbekistan, Turkmenistan, and some Caucasian states, such as Azerbaijan and Armenia, also share the same tradition and celebrate Yalda Night. Astronomically, it is a night of the Northern Hemisphere's winter solstice. The winter solstice is an astronomical phenomenon marking the day with the shortest period of daylight and the longest night of the year. As days start lengthening, ancient Iranians believe that darkness is defeated by light, and therefore they must celebrate the whole night. On this night, family members get together, most often in the house of the eldest member, and stay awake all night long. Dried nuts, watermelon, and pomegranate are served as supplications to God for increasing his bounties. The red color in these fruits symbolizes the crimson hues of dawn and glow of life. Another favorite and prevalent pastime of the night of Yalda is Fale Hafiz, which is divination using Divan of Hafiz. As a 13th century Iranian poet, Sadi writes in his book Bustan, the true morning will not come until the Yalda night is gone.
Thank you very much. I think that was an informative clip from our culture, and you can understand how our culture works a little better. Iranians actually like to gather around together a lot, talk together a lot, and this kind of communication, this kind of society can be seen in all of our culture and our history. And I hope that better days can come in healthcare issues for all the countries all around the world, and we can have better healthcare system, better healthcare workers, and facilitate the problems that we are facing right now, and have a healthy planet altogether. Now I invite Ms. Hassan Tabar to continue with the program, and we can see some of the objectives of our faculty in a better view. Thank you.
Distinguished colleagues, esteemed guests, and fellow leaders in health, it is an honor to stand before you today to share a vision for the future, one where the health of our planet and our people are inseparably linked. At Tehran University of Medical Sciences, we recognize that health extends beyond individuals and communities. It is intrinsically tied to the health of our shared environment. Our journey forward must prioritize sustainability, community well-being, and the urgent call to protect planetary health in every aspect of nursing and midwifery. Today, I am privileged to unveil our refined mission, vision, and goals for advancing planetary health at TUMS. Our mission is to transform nursing and midwifery into driving forces for planetary health. We are committed to embedding environmental stewardship and sustainability into our education, research, and practice. Through systems thinking and culturally sensitive approaches, we aim to empower individuals and communities to embrace lifestyles that nurture both human and planetary well-being. From childhood to elder care, our focus will remain on holistic health, physical, mental, social, and environmental, while addressing the profound challenges of environmental degradation, health inequalities, and climate change. By aligning care with the principles of planetary health, we will preserve ecosystems, safeguard communities, and celebrate the traditions that connect us to our environment. Our vision. We envision thriving, resilient communities where environmental health is the cornerstone of human well being. Picture families flourishing in clean, green environments where care is sustainable, community driven, and centered on life itself. Imagine children playing beneath clear, unpolluted skies, elders finding peace in vibrant green spaces, and neighborhoods powered by renewable energy, clean water, and eco friendly infrastructure. Our vision draws inspiration from cultural Yalda, the ancient Persian celebration of light, hope, and renewal during the longest night of the year. Just as Yalda symbolizes the triumph of light over darkness, we are reminded of our collective responsibility to nurture and heal not only our bodies but also the environment that sustains all life. At Tehran University of Medical Science, we recognize that environmental and cultural wisdom are essential pillars of resilient health systems. While our roots are deeply embedded in Iran, our vision transcends borders to embrace a global perspective. We are committed to fostering solutions that not only honor our cultural heritage, but also address the interconnected health challenges faced by communities around the world. By bridging local insights with global initiatives, we strive to build a healthier, more sustainable future for Iran and the broader global community. To make this vision a reality, we have established actionable goals that emphasize planetary health at every level. In short term, we strive to integrate planetary health principles into nursing and midwifery curricula, equipping students with the knowledge and skills to address environmental and health challenges. We will promote sustainable community based initiatives that focus on family well being, mental health, and aging care, grounded in ecological and environmental responsibility. Additionally, we will empower individuals with tools to improve physical and mental health through environmentally friendly practices, fostering resilience in the face of climate challenges. Our long term goals focus on developing sustainable, inclusive health systems that address environmental and health, with a particular emphasis on vulnerable population. We aim to establish interdisciplinary research hubs to generate knowledge and solutions for planetary health, local, regional, and global scale. Furthermore, we will advocate for green infrastructure in neighborhoods, school, and care settings, ensuring clean air, renewable energy, and sustainable practices become the norm. We also will elevate traditional cultural values and practices that inspire harmony with nature, embedding these values into health education and community empowerment initiatives. By achieving these goals, we will advance planetary health through education, research, and most important, leadership, strengthening community resilience and fostering a future where human and environmental well being coexist in harmony. At Tehran University of Medical Sciences, we recognize that local action is essential for global progress. By addressing planetary health challenges in Iran's communities, we also contribute to solutions for the world. We aspire to position Tehran University of Medical Science as a global leader in planetary health education, research, and practice, nurturing the next generation of health leaders who will champion equitable and sustainable solutions for our shared future. Thank you.
Thanks a lot. I hope that you're all having a nice time here as we do. So thank you to my colleagues. I would like to introduce Miss Lena Kampen, who is an Assistant Director for Academic Service, Ramat Hobodi, School of Ms. Lena Kampen, PhD candidate and research fellow at German Heart Center, Charité Medical University in Germany. So she's going to be with us with the topic of non-communicable diseases and planetary health, spotlight and cardiovascular diseases. So I would like you to join us. That would be great to have you with us. And sorry for the mispronunciation in the affiliation.
No problem. Thank you for the very nice introduction. I will go ahead and share my screen and then get started.
So if you have any technical problems, I'm going to solve it with the team. Can you share your screen?
Yes, I am. Can you see it?
Unfortunately, we're not seeing your skin yet.
Okay, then I'll try again. How about now?
We have your screen now.
Perfect. And it's also in presentation mode, correct?
Yes, it is. Thank
Good.
you.
Then let me turn on my pointer and then, yes, get started. Thank you very much for the nice introduction. I am here today to talk about an emerging crisis at the intersection of human health and the health of our planet. My presentation will be about how the state of our planet is intrinsically linked to non-communicable diseases, with a particular focus on cardiovascular diseases, which is one of the leading causes of death worldwide. But before we dive deeper into today's topic, I'd like to quickly introduce myself as well. My name is Lena Kampen. I hold a master's degree in molecular medicine, and currently I'm working as a research fellow and pursuing a PhD in cardiovascular research. I've structured my talk into 3 major points. First, I'd like to start with giving a quick introduction into non-communicable diseases and why it's important that we're talking about them today as a global challenge. Then I'll dive into my main point, which is going to be on planetary health and non-communicable diseases. And here I'll focus on 4 main points. I'll focus on climate change, novel entities, air pollution, and biosphere integrity. And then lastly, I will be talking about co-benefits for people and planet, and discuss actionable solutions that benefit both our health and the planet. So I hope that by the end of this presentation, you'll see that protecting our planet is not just an environmental responsibility, but it's really a health imperative. So let's get started. As I already implied, non-communicable disease really are a global problem. They account for 74% of deaths globally. So these are numbers from the World Health Organization in 2023, so last year. Alarmingly, 41% of these deaths occur prematurely, so before the age of 70. I also looked up the numbers for Iran, and the most recent numbers I found were from 2018, where non-communicable diseases accounted for 83.5% of death in Iran. But before we go in deeper, I'd like to take a step back and have a look at what non-communicable diseases actually are. Non-communicable diseases are, in short, NCDs, are not passed from person to person, so in contrast to infectious diseases. They are usually of long duration and generally slow progression. What you could call big four non-communicable diseases include chronic respiratory disease, cardiovascular disease, in short CVD, cancer, and diabetes. And interestingly, most non-communicable diseases share a lot of pathophysiological mechanisms that underlie their onset and progression. The two most important ones are highlighted here. They're chronic inflammation and chronic oxidative stress. If you have a persistent inflammation and persistent oxidative stress in the body, that can lead to DNA damage, tissue damage, and cellular damage, ultimately contributing to the development of these non-communicable diseases. In order to really understand how planetary health is linked to non-communicable diseases, you have to understand how this chronic inflammation and chronic oxidative stress can occur. These two processes usually are triggered by an initiating stimulus. This initiating stimulus can be an environmental stimulus like pollution or heat stress. It can be a behavioral stimulus like an unhealthy diet. And once the stimulus enters the body, it's perceived as a threat and triggers a local inflammatory response. This response includes the activation of immune cells, and activated immune cells then cause the release of inflammatory mediators. They also lead to the release of reactive oxygen species, in short, ROS. These ROS are highly reactive molecules, and they play an important role in cell signaling and immune defense. Both of these processes, so inflammation and the release of reactive oxygen species, they're really linked. So inflammation induces the production of ROS, while the presence of ROS also activates immune cells. So this can really create a harmful feedback loop. But generally speaking, both of these responses are very vital to fight infections and to repair damage. The problems really only arise when they persist without resolution. So if inflammation and oxidative stress, so oxidative stress is just the term that is used when you have an excessive presence of reactive oxygen species. So when they persist and the body fails to resolve these two processes, then you have the shift from an acute inflammation and acute oxidative stress to a chronic status. And that can really be dangerous because on the one hand, these molecules, so ROS, inflammatory mediators, and also activated immune cells, they can be transported through blood vessels and spread systemically. And through that way, they can cause systemic effects. For instance, ROS, so these reactive oxygen species, they can directly damage the DNA or proteins in the body, lead to cellular damage, and this then really can damage different organs such as the heart, the lung, blood vessels, and drive the development of non-communicable diseases. So this connection between an initiating stimulus and then in the end a systemic chronic inflammation and chronic oxidative stress as underlying drivers to develop non-communicable diseases is, like I said, very crucial, and you'll see this scheme reappear throughout my presentation. But now I want to start focus on these initiating stimuli. And a different way of framing this is calling them risk factors. Risk factors for non-communicable diseases can be metabolic, they can be genetic, they can be socioeconomic, behavioral, like the unhealthy diet I just mentioned. But the topic of today's talk will be environmental risk factors. And I'll particularly focus on climate change, on pollution, and also biodiversity loss, which is more of an indirect risk factor for a non-communicable disease, but you'll see how later during this talk. These four bullet points you might recall from this planetary boundary framework that I'm assuming Oscar introduced this morning. And you can see that 3 out of the 4 environmental risk factors that we're going to be talking about today, so climate change, novel entities, and the biosphere integrity, already crossed the safe operating space and exceeded the planetary boundary. Whereas the 4th point, atmospheric aerosol loading, is still within the safe operating space, but air pollution is becoming an increasing problem, especially in urban areas. That's why I wanted to pick it up today and discuss this as well. The first risk factor, the risk factor for non-communicable disease that I want to talk about in a bit more detail, is climate change. Climate change can really impact health and drive non-communicable diseases through various pathways. These can be direct or indirect. A direct pathway would, for instance, be an increasing occurrence of heat extremes, lead to heat stress, which directly can result in higher incidence of cardiovascular disease and chronic respiratory disease. A second example for a direct pathway would be less rainfall. Less rainfall can result in higher levels, higher ground levels of air pollutants, again, causing the direct increase in cardiovascular disease and respiratory disease. A more indirect pathway would be that climate change also increases the incidence for droughts and flooding, which can reduce food yields and cause malnutrition, leading to poor general health, which can then indirectly also impact the non-communicable disease incidence. And then lastly, I wanted to mention that climate change can also, or leads to more extreme weather events, which can be traumatic. They can impair livelihood, lead to impoverishment, and that can impact the mental health as well. And mental health is also often discussed within the frame of non-communicable diseases. I just wanted to mention it here, but we're not going to be focusing on mental health today. We are more going to be focusing on cardiovascular disease, like I said in the beginning. And the first thing we're going to have a closer look at is how heat extremes are connected with an increasing incidence of cardiovascular disease. In order to understand this a bit better, I brought you this scheme from a review that was published in 2022. And they depicted this very nicely, where they showed that initially an increased heat exposure, for instance, during a heat wave. So the first thing that happens is your core body temperature also increases. This increase in core body temperature has 2 major effects. One is that it increases the gastrointestinal permeability. So the gastrointestinal tract is very sensitive to heat. And if it experiences heat stress, the intestinal epithelial barrier is disrupted and becomes leaky and allows endotoxins that are released from bacteria to enter the bloodstream. In the bloodstream, the endotoxins then activate immune cells and trigger the release of inflammatory mediators. And you might recognize that from the beginning, that is one of the first steps that can lead to a chronic, systemic inflammation. And then the second pathway that occurs is that increased core body temperature directly damages muscular tissue and damages the cells there, which triggers a further activation of the immune system and a further release of inflammatory mediators. So you could sum it up by saying that heat stress induces an environment that is very conducive to develop non-communicable disease because it triggers systemic inflammation. And if the body fails to resolve this systemic inflammation, it can become chronic, and that is, as we know, the underlying driver for non-communicable diseases. However, that's not all to the story of heat stress, because heat stress is not only a risk factor for the development of non-communicable disease, it is also directly associated with an increased mortality. This study from 2023 examined 35 European countries during the summer of 2022, which was one of the hottest summers in Europe so far. And they found that an increased temperature also leads to an increase in heat-related mortality. So you can say that rising temperature causes an increase in heat-related related mortality. But the question is how is heat related to mortality? What happens inside the body? Why does heat trigger mortality? And in order to understand that, you need to examine the disease atherosclerosis. Because it is the leading cause of death that is linked to heat exposure. Atherosclerosis is one of those chronic inflammatory diseases, and this disease affects large and medium-sized arteries. And as I said, it's the main cause of death during heat waves, but also the main cause of death among the group of cardiovascular disease. And in atherosclerosis, a so-called atherosclerotic plaque develops. This plaque contains immune cells that infiltrate. It contains fatty cells, fat-containing cells. It contains oxidized LDL. And over time, this plaque can develop and become more and more unstable. And eventually, this plaque can rupture. If this plaque ruptures, all the components that were previously contained in the plaque are exposed to the bloodstream. And that triggers then the formation of a thrombus. And depending on where this thrombus is localized, so if it's in the heart or in the brain, it blocks blood flow, and that can then cause a heart attack if it's located in the heart, or a stroke if it's located in the brain. So atherosclerosis is the main cause of or underlying cause that then can lead to heart attack and stroke. So what does that now have to do with heat? When a susceptible individual, so an individual that's already that already has an atherosclerotic plaque inside the body, experiences heat stress, the body reacts like everybody. Was sweating, was vasodilation, it causes an electrolyte imbalance, and eventually that leads to an increase in blood pressure and an increase in heart rate. However, this increasing pressure and heart rate really puts a lot of stress on this atherosclerotic plaque that is located in one of the arteries, and that can then cause the rupture. And the rupture then can cause heart attack and stroke, explaining the increased mortality during heat waves. So we've seen that climate change can really affect not only the NCD development, but also directly trigger the rupture of an atherosclerotic plaque. The next risk factor I want to have a closer look at are novel entities and their connection to non-communicable diseases. And in particular, I want to have a closer look at micro and nanoplastic. Micro and nanoplastics are everywhere. They're in our food, they're in the air we breathe, they're in our personal care product. They surround us, and they can enter the body through three main ways. Either you inhale them, you ingest them with your food, or you come in contact with them over your skin. Once micro and nanoplastic is inside your body, they can again induce this triad. They activate immune cells, they cause the release of inflammatory mediators and the production of reactive oxygen species. And if this plastic remains present in your body, then or you're constantly re-exposed to it, then the inflammation persists, and it can become chronic inflammation, chronic oxidative stress, being the underlying driver of non-communicable diseases. But micro and nanoplastics can also enter the bloodstream themselves. And one study that looked at that a bit more in detail is a study that was published in 2024. The authors of this research investigated 275 patients, and they isolated plaques, atherosclerotic plaques from 270 patients, and assessed whether there was micro and nanoplastic located in the plaque or not. And they found that in 150 patients, there was plaque evidence of micro and nanoplastic in this plaque. And after they divided the patients in these two groups, they assessed the occurrence of the primary endpoint events, which they defined as non-fatal myocardial infarction, non-fatal stroke, or death from any cause. And interestingly, they found after 34 months that the patients that had micro and nanoplastics in their plaque also showed a higher rate of these primary endpoint events, with 20% of patients experiencing these primary endpoint events, in contrast to only 7.5% in the group that did not have the plastic in the plaque. And the same study also had a look at the amount of inflammatory mediators in these patients and compared the two groups again. And they found that the patients that had micro and nanoplastics in their plaque also showed higher levels of systemic inflammatory mediators like interleukin-18 or TNF-alpha. So in summary, you can say that micro and nanoplastic directly induces higher inflammation and increases the risk for primary endpoint events, which patients with micro and nanoplastic in their plaques experience more often. A similar connection can be observed for air pollution. Air pollution is very deadly as it causes 7 million deaths per year worldwide. And the majority of these deaths are caused from ischemic heart disease, and another 20% are caused from stroke. And you might recognize ischemic heart disease and stroke are both majorly caused by the rupture of atherosclerotic plaques. Air pollution is defined as just any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. There are several sources of air pollution, both indoor and outdoor, such as dust, cars, fires, chemical reactions, cooking, candles, smoking, and so on. So you see air pollution is really a big problem. When research looks at air pollution, most papers look at so-called particulate matter, in short PM. The particulate matter is subcharacterized based on its size, and also depending on the size, they can reach the upper or lower respiratory tracts or the alveoli, and then induce again an activation of the immune cells, the release of inflammatory mediators, and the production of reactive oxygen species. These mediators can, if air pollution is persistent and the initiating air polluting stimulus is not resolved, become chronic and cause a systemic chronic inflammation and systemic chronic oxidative stress. Unlike the plastic, the air pollutant, so the particulate matter, can also itself travel throughout blood vessels and have systemic effects, like you can see here. So in summary, air pollutants are another initiating stimulus that can initiate chronic systemic inflammation and oxidative stress, inducing the development of non-communicable diseases. The last, I would call it risk factor, but point I want to look at is not so directly linked, like air pollution, where you have a trigger air pollution that triggers inflammation and that can result in the development of non-communicable diseases. But you'll see that biosphere integrity and the risk to develop non-communicable diseases share a common thread. And what that is, you'll find out in a second. But let's first look at what biosphere integrity even means. So biosphere is just the part of the Earth's environment where life exists. And the boundary for biosphere integrity has been crossed. And biosphere integrity is characterized by an increased species extinction, and habitat degradation, and loss of genetic heritage. If we now look at, okay, what causes biosphere integrity, you quickly come across land use change of one of the major drivers, especially for terrestrial biodiversity loss. And land use change, which is just the process of human activities transforming natural landscape, is usually or most often driven by agricultural, by the conversion to agricultural land. If you zoom in a bit more, you see that most of agricultural land, 78%, is used for livestock. And interestingly, livestock consumption only accounts for 17% of caloric supplies globally, meaning that the rest, the 22% of agricultural lands that are used for crops, generate 83% of the global caloric supplies. So livestock agriculture really is a big threat for biosphere integrity, as it requires a lot of agricultural land. And at the same time, meat, especially red meat, is also harmful to human health. Red meat contains a lot of components that induce inflammation, such as heme iron, short-chain fatty acids, and nitrates and cholines, which can be metabolized to inflammation-inducing compounds. And by now you know the story. Inside the gut, they can then activate immune cells. They can induce the release of inflammatory mediators, induce the production of reactive oxygen species. And if the stimulus remains present or is consistently present, it can lead to a systemic chronic inflammation and oxidative stress. So meat, especially red meat, is a threat to both human health, but also to planetary health by affecting biosphere integrity. At this point, I'd like to take a step back and briefly summarize what we've discussed so far. So we've explored how non-communicable diseases like cardiovascular disease, cancer, diabetes, and chronic respiratory disease share common underlying mechanism: chronic inflammation and chronic oxidative stress. And we learned that an environmental stimuli like micro and nanoplastic, heat stress, air pollution, and red meat can trigger these mechanisms and ultimately lead to systemic damage and the development of non-communicable diseases. So we see that rising temperatures, pollution, microplastic, loss of biodiversity, they're not just a problem for environmentalists, they're fueling an unprecedented rise in non-communicable diseases. Now that we've seen the scope of the problem, the good news is solutions exist. And solutions exist that simultaneously reduce the risk for non-communicable diseases, but also benefit planetary health, so-called win-win actions. And some examples of these easily to implement win-win actions are: one, adapting to a plant-based diet, so eating less fruit from animals and eating more local fruits and vegetables. And this is beneficial for us humans. It reduces non-communicable disease risk by having less intake of these inflammation-inducing compounds that are especially in red meat. And at the same time, reducing meat consumptions decreases the requirement for agricultural land, thereby slowing biodiversity loss. A second example would be a shift towards more active transport and less high-emission vehicles. Active forms of transport are great because physical activity directly lowers inflammation by enhancing metabolism and reducing oxidative stress. And at the same time, moving away from high-emission vehicles reduces the consumption of fossil fuels. It improves air quality, which is again then good for human health. Another examples would be less plastic use and production, which is directly good for human health because you have less exposure to micro and nanoplastics, and you have less environmental pollution. You protect ecosystems. And then more green spaces are great for human health because it lowers the exposure to heat extremes. It reduces heat stress, and encourages physical activity as well, which is again good for human health. And it was also shown that spending time in green areas directly lowers systemic inflammation and oxidative stress. And urban green spaces are great to enhance biodiversity, to reduce carbon dioxide levels. Researchers have focused a lot on this less animal intense, more fruits and vegetables diet, and they came up with this Planetary Health diet in, I think, 2019. And if you're interested in this, the Eat Lancet Commission really does great work on this. And it is one way of consuming food that is both good for your health and reduces non-communicable disease risk, but also benefits the planet. I would like to come to an end with my lecture and point out that while we've just discussed personal actions that you can take, so eating less animal food from animals, active forms of transportation, using less plastic, you can also become active in your professional life. You're already doing that by educating yourself. You can educate others, promote these health benefiting strategies that benefit health and planet and clinical practice, get involved in planetary health research, and you can really become change makers. With that, I would like to thank you very much for your attention. I'd like to thank the organizers of this conference to give me the opportunity to talk during this event. And yeah, feel free to connect after. Here's my contact if you have any questions, but I'm also very happy to answer your questions now. Thank you.
Thank you very much, Dr. Compen. That was a great speech. I actually use a lot of that information because my field of work, my field of research is actually cardiovascular nursing. And this was very, very insightful for me to combine cardiovascular nursing, cardiovascular medicine with planetary health problems. And I will definitely use these kind of concepts in my future researches and in my future studies. What I wanted to ask from you is that, as we know, in low-income countries, anxiety is actually a very, very important factor in patients with cardiovascular disease, because we all know that cardiovascular disease is the leading cause of death all around the world and is a very, very burdensome disease in a lot of countries that can be very costly for the patients and for the healthcare system because of some chronic problems like heart failure or left ventricle failure that can be problematic and that can be longitudinal and put a burden on the society, on the patients, and on their caregivers and familiar caregivers. What is my point here is that postmodern societies are actually human beings that are very lonely and don't share that much, and this can lead to anxiety. And I wanted to know how much of a confounding factor you think anxiety is in all these matters, especially in things like atherosclerosis, because my own father has actually done 2 times of PCI and had a myocardial infarction 2 times when he was younger than 50. And his lifestyle was actually a very healthy one. He actually he was a professional sportsman, he was a professional athlete, and he was a national referee. And these kind of problems in my country are happening more and more. A lot more people are in younger ages are facing cardiovascular diseases that have good lifestyles, that have healthy lifestyles, but are facing these kind of problems. So I wanted to know how much of a compounding factor, how much of an important factor you think anxiety is, because in my own researches, I always struck my mind that anxiety is the cornerstone of cardiovascular diseases in these ages.
Thank you very much for your input and for the great feedback. So there are several points you made. One important thing that I want to really stress is that you just saw, hopefully in my presentation, that it's not just a healthy lifestyle, that these environmental risk factors really can very much influence and lead to the development of non-communicable diseases, even if you stick to a healthy diet. That's one point. But it's not the whole story. That's the tricky part about these non-communicable diseases. Not one trigger that causes the disease. It's several factors coming together. So you can't really point towards, okay, this is now the reason you changed this, and then everything's good and you're healthy again. And the same accounts for anxiety and mental health issues, where they can really also influence the general health of the entire body, and also lead to more inflammation, a weakening of the immune system. So it's really, everything's interconnected, and that makes this field of research so interesting to me, but also very, very tricky to grasp all the interconnections between the different points.
Thank you very much, Dr. Compan. I wanted to ask the last question, and after that, we'll be done. I'm very, very thankful for your research, for the study that you've done in this field, and your speech was very, very insightful again, and I thank you again. I wanted to ask you about the healthy eating that you talked about, like having more local vegetable and stuff like that. As you know, it's the demand thing in low-income countries. In Europe, there are more organic eating facilities, and they make more of those things. But in Iran, we don't have that much of factories, fields, agriculture that actually focuses on these kind of organic eating, organic materials. So they are a lot more costly in a low-income country. So what is your suggestion for us who are living in a low-income country and we want to have a diet that is not full of animal meat or red meat?
Yeah, that's a very, very important point. And I want to first disclaim that I am sitting in Germany in a very privileged position, where I have the opportunity, of course, to choose more organic products. But what I really want to point out is that it really is essential to look at the local food available. So a planetary health diet in Germany can look different than a planetary health diet in Iran. It means that the diet should ideally consist of 50% of fruits and vegetables, but what these fruits and vegetables are should ideally be tailored to what fruits and vegetables grow in your local area. But then it's also important to notice that in some areas, they're, for instance, very rich in heavy metals, which can then again be a threat to your health. So it's a very, like everything, it's a very tricky thing. It's not a one solution fits all. So I'm very thankful that you pointed that out. It's not as black and white, where you just eat less meat and then everything's good. So yeah.
Okay. Thank you very much. Now
Thank
I
you.
want to ask Ms. Hassan Tabar to continue with the program. Thank you very much, Dr. Compan.
Thank you very much, dear Lena, and thanks for accepting our invitation. It was a very informative talk. With that, I would like to say goodbye and move on to our
Goodbye,
next
thanks.
speaker. So, dear Karen, do you hear us?
Yes. Can you hear me okay?
Yes, perfectly. Would like to say hello, and I hope the timing is not bad for you.
It's great. Thank you.
Okay, great. So the floor is yours. Would like to hear your presentation.
Right. I'm going to try to share my screen. Do you see my screen in the right mode?
We can perfectly see your screen, but before that, we would like also to introduce you. So
sure.
Before you start.
So hello, Ms. Karen Noahadi. It's a great pleasure to have you with us today. To introduce you to our audience, I have to say that you're a scientist in Potsdam Institute for Climate Impact Research in Germany, and also a co-founder and executive director in Foodagogik, Indonesia. So the topic you're going to discuss is localizing food systems for planetary health in Indonesia. The floor is all yours and we are all ears.
Great, thank you for the introduction. You're correct. Let me just introduce myself once again. My name is Karin Nurhadi. I'm a food system scientist at the Potsdam Institute for Climate Impact Research. I'm also the co-founder and executive director of a newly established research institute based in Jakarta called Foodagogik Research Institute on Food Climate Health Dynamics. Today, I would like to talk to you about food. So not so much about medicine, but particularly about localizing food systems for planetary health in Indonesia. And I hope we'll get to know how food is intricately related to the health systems. I think we've also talked about in the previous from the previous speaker. I'd like to start with just a bit of context, why food is important to talk about, and simply because food is failing us, right? So if we look at global food systems challenges, the current global food system, which is characterized by food system elements that operate globally, is the largest emitting sector of greenhouse gases worldwide. About 21 to 37% of the total greenhouse gas emissions are attributed to the food system, and these are mainly from agriculture, land use, storage, transport, packaging, processing, retail, and consumption. So really from production all the way to consumption. Global food systems are also the primary drivers of biodiversity loss, ecosystem destruction, freshwater consumption, and the transgressions of other planetary boundaries. And despite its focus on production, productivity, efficiency, many people still lack access to sufficient food, let alone a healthy diet, which has been contributing to an increased prevalence of non-communicable diseases and up to 11 million deaths per year. This is data from 2021. Here's a figure from a study conducted in 2020 showing an estimate of the global food systems transgressions of planetary boundaries. So there's 9 planetary boundaries. I think previous speaker also mentioned about this briefly. Those highlighted in colors are boundaries that are quantified, and those in white are still unknown. And everything in green, hopefully you can see my pointer, are an estimate of the food-related share of the planetary boundaries that are within the safe operating space. So they don't have harmful impacts to these planetary boundaries. However, we can see that none of the boundaries that have been quantified are actually within the safe operating space, because 4 are highlighted in yellow: nitrogen application, freshwater use, cropland use, and greenhouse gas emissions. And the other 2 are in red, so representing a high risk of transgressing the planetary boundaries. So the global food system is sort of eating more than it can chew, right? It uses more resources than it gives benefits to human and planetary health, and also in turn transgress the Earth's safe operating space. And a similar trend is also observed in Indonesia. Indonesia is consistently ranked in the top 10 greenhouse gas emitters in the last decades, together with many industrialized countries. Although Indonesia is not an industrialized country. However, unlike industrialized countries where emissions are mainly attributed to the energy sector, 57.2%, so over half of the emissions in Indonesia are actually attributed to the food system sector, from agriculture, forestry, and other land use sector. And this is largely because Indonesia uses 1/3 of its land area for agriculture, converting forests, mangroves, peatlands for agricultural production, which result in biodiversity and habitat loss. Down the consumption side, we also see a similar trend where suboptimal diets are the leading public health risk that causes up to 7 million deaths, or 10% of all deaths in 2021. And when I talk about suboptimal diets, I really mean diets high in sodium, low in fruit and vegetable intake, as well as other food groups recommended in the Planetary Health Diet. We also talked about this briefly. The key drivers of change of these challenges in Indonesia revolve around 3 food systems elements. First one is production. So we continuously struggle with misaligned production policies to food, climate, and health targets. For example, most agri-food policies prioritize staple foods, particularly rice, maize, cassava, to address malnutrition. And these policies are often translated through large-scale programs that open lands for monoculture farming, exacerbating biodiversity loss, also ignoring regional diversity and the multifactorial nature of nutrition challenges. Another food system element that is considered the driver of change in Indonesia is consumption. We are experiencing the triple burden of malnutrition and dietary transition, where consumption of ultra-processed foods is increasing, mainly because of the higher availability, accessibility, and affordability of these products compared to healthier food items, such as fruits, vegetables, whole grains. And lastly, we are simply wasteful, right? Ironically, while many people still lack access to, not even access, still struggle to meet daily dietary requirements, 23 to 48 million tons of food are wasted, and 44% of it being rice, which is the most prioritized commodity in the country. And combining all these drivers of change with population growth, income growth, demand for animal-sourced foods, and climate change, of course, our food systems are under pressure and in urgent need for transformation. Now that we've addressed the challenges, we'll turn our attention to some solutions, focusing on the concept of the localization of food systems, which is an approach often proposed as sort of the antithesis of global food systems. Even considered as the antithesis, many local food system scholars have argued that the local scale is not inherently good, which means local food systems do not automatically produce desirable food system outcomes or more positive outcomes than the global food system. There has thus far been no consensus on the meaning of the word local in local food systems, and this may stem from the fact that local is simply contextual, right? It's place-based. But recent systematic review showed that its impact is highly dependent on the type of supply chain at hand and differs across products and countries, right? Going back to the idea that local is contextual. But if we could sort of conclude it in a short way or a clearer way than local is contextual, we can generally define local encompassing 3 key domains of proximity. One is geographical proximity, or the distance between producers and consumers. Usually this is measured by food shed, so minimizing the activities where food systems operate, or short food supply chain, which is very common in Europe. And then there's also relational proximity, or the close connections among actors within the food systems, whether or not we know the producers of our food, etc. And lastly, proximity in values, which is usually characterized by origin, freshness, quality, and seasonality. And the theoretical framework for the notion of local is important because we're going to look at how local is implemented in Indonesia. And it was not until October this year that Indonesia showed its political commitment to localization through the newly presidential regulation number 81/2024 on the acceleration of food diversity based on the potential of local resources. And this regulation outlines several localization strategies, one being strengthening agri-food policies, optimizing land use, promoting local foods and local industries, and many other strategies, right? While the effective implementation of this regulation is yet to be seen, since it's a relatively new regulation, establishing such framework to support the transformation of food systems toward improved human and planetary health is definitely considered progress. This progress is also aligned with the findings of our current research at Foodagogic, which can be accessed through this QR code shown here. We conducted a Delphi study involving experts from the food, climate, and health sectors in Indonesia to identify effective, impactful, and strategic food system entry points for transforming the current Indonesian food systems that can provide positive climate and health co-benefits within the next 10 years. And our findings revealed that localization, diversification, and indigenous wisdom are the pillars of sustainable food systems in Indonesia, and sort of like the characteristics of archipelagic food systems. We've also expanded our analyses via a causal loop diagram to identify the dynamics across the identified food system entry points. And here I'm showing the dynamics between crop diversification, local foods, and traditiovations, which are innovative approaches rooted in traditional ecological knowledge. And if we take a closer look at this diagram, we can sort of conclude, obviously qualitatively, that localizing food systems for planetary health in Indonesia seems feasible, right? Localization strategies such as agroforestry systems, urban agriculture, integrated aquaculture, or even the cultivation of neglected and underutilized crops, for example, are renowned strategies based on literature and many experimental studies to not only increase the availability and accessibility of local foods, but also deliver positive impacts on ecosystem health and food cultures, right? So through crop diversification, for example, or through traditiovations that support crop diversification, will also lead to positive impacts on soil health, biodiversity, climate resilience, as well as cultural identity. And obviously, again, this is still a qualitative conceptual framework, which means the quantified relationships are yet to be established, but a preliminary diagram such as this offers insight into how localizing food systems in Indonesia could positively impact planetary health. And this change will require radical shifts, right? For example, we need to change or shift from monoculture farming or monoculture production of rice, for example, to more diversified homestead production. Or on the consumption side, maybe shifting dietary patterns from processed foods, a lot of wheat or imported wheat noodles, to more homemade meals, high in fruits, vegetables, and whole grains. This is coming to sort of the end of my presentation. I'd like to go into the challenges and opportunities to localize food systems for planetary health. One challenge is that much relevant knowledge remains unknown, and science and research continue to be underprioritized. We can see that from the R&D expenditure in Indonesia, which is about 0.24% of its GDP. That is among the lowest compared to other Southeast Asian countries, for example. And if there is funding for science and research, it is heavily concentrated in agriculture productivity, about 53%, while other impact areas that are more related to human and planetary health receive significantly less. For example, 11.2% for nutrition, 3.8% for environmental sustainability, and 2.2% for climate change. Another challenge is that policy decisions often lack public input or civic contribution, expert analysis, as well as robust monitoring and evaluation systems, which results in unsuccessful large-scale projects to be continuously promoted despite their negative impacts. But there are also many opportunities. This year particularly is favorable for food systems transformation in Indonesia. For example, sustainable food systems are gaining momentum. The discourse is getting more and more pronounced among the public, and organizations in the field are beginning to collaborate, although their connection to planetary health remains underexplored. There's also the Presidential Regulation 81/2024 shown earlier, which provides sort of like an enabling condition for transformation, right? Usually there needs to be a regulatory and political framework as well as financial resources. And this regulation demonstrates two of the first indicators of food systems governance, which are shared vision and strategic planning and policies. Lastly, food has become a strategic national priority under the newly elected president. So over the next 5 years, we can expect increased attention to food-related issues, hopefully approach more from a food systems perspective. Closing the presentation and looking ahead, I expect that over the next 5 to 10 years, we will anticipate the effective implementation of the newly established presidential regulation on whether, for example, existing and upcoming food and agriculture programs support climate and health targets, or whether agri-food policies have already prioritized or have started to prioritize sustainable local food production, and whether local foods are more available, affordable, and accessible, and also whether there is adequate support from local governments if localization strategies such as home gardens or homestead production are sort of the goal for the future. And at the same time, comprehensive and contextual evidence base for food system science must be built. This is where we are lacking the most. Questions like how much can agroforestry systems or urban agriculture or other localization strategies support the domestic production of fruits and vegetables, or I guess other nutrient-dense, low-emission food products? And if the production of fruits, vegetables, and other perishable, nutrient-dense, low-emission food products is optimized, how can we ensure sufficient storage and transport infrastructure while making these products more affordable than comparable imports, right? Also, we mentioned about planetary health diet being contextual. How do culturally appropriate Indonesian food plates that support both human and planetary health diet look like? What would an ideal model be? And if there is an ideal model, how do we mainstream these models into public institutions, such as schools, workplaces, hospitals, etc.? These are some foundational questions that need to be addressed to effectively implement localization, but hopefully this can be achieved through long-term partnerships and place-based innovations that strengthen science policy practice interface and also integrate diverse sources of knowledge, being scientific, indigenous, and experiential knowledge. And with that, I'd like to close this presentation. Thank you so much for your attention and the opportunity to speak at this conference. I look forward to your questions and to connecting with you. Here
Thank you
is
very
my
much,
references.
Dr. Norhadi. Do you have my voice?
Yes, I can hear you.
Thank you very much. That was a very, very well-rounded speech that encompassed all of the aspects of local food and stuff that we care about in planetary health. I have two questions from you that are actually related to my own country. And the first one is, I think this is a very nice insight to have. This is a very nice goal to have, to localize the food. But the biggest point in low-income countries is that GDP per capita is pretty low here. So if a lot of, I think in our industry, especially when we are talking about processed meat industry or about producing meat industry, these encompass a lot of our jobs, and a lot of low income families in our country are working in those kind of facilities. So if we focus on stuff like organic food, local food, these people might lose their job temporarily. I mean, temporarily, because these kind of industries, localized industries, need time to grow. So at the beginning of them, some people will lose their jobs, and we need funding for these people. And as you said, you have a regulatory system in your country to control these kind of problems and fund these kind of projects, and we don't have that in our country yet. And this can be quite problematic. This is my first question. And my second question is actually about the lifestyle. I mean, this is, I think, sometimes neglected. As you know, in Iran, a lot of people have been ranchers because of the climate that they had, cold climate and mountainy grounds that were not good for agriculture. There were not enough water. So these people were ranchers, and they've grown up with eating meat. I mean, red meat is part of their culture, is not just part of their eating habit. Yeah, I mean, I've seen patients that were like, okay, I can't stop eating meat, even if I have a big cardiovascular problem, even if I have any kind of disease that is related to this lifestyle of mine, to this habit of eating of mine, I can't put it aside. So how do you think we can actually treat with these kind of people that eating meat is a part of their culture, part of their, I mean, family or generational thing? Thank you.
Yeah. Thank you so much for the questions. Excellent questions. The first question is one that we are, or I guess both, but the first one is one that we are confronted constantly. I guess for countries where political or regulatory framework are not available just yet, activities or initiatives from the bottom up would make a lot of change. I'm not sure how the sort of like the civil society organizations operate in Iran, but in Indonesia, for example, grassroots movements play a huge role in sort of influencing or shaping regulatory framework. So I would start from there, right? Start small, but keep the fire going, so to speak. I hope that answers your question. But for the second question regarding lifestyle and dietary behaviors, it's also a huge discussion right now in the food system discourse, because dietary change alone can actually improve or transform food systems positively and dramatically, about 60%, I think, reducing the greenhouse gas emissions, if I'm not mistaken. But we're coming back to the discussion about context, right? If we take a look at planetary health diet, for example, much of the data being used are from industrialized countries where high red meat consumption is very common. And this approach or this sort of like model may not work for countries like Indonesia, where the challenges in terms of malnutrition or the triple burden of malnutrition still heavily or like more heavy on the undernutrition side, stunting, wasting, micronutrient deficiencies, which is arguably can be supported more effectively or faster with animal sourced foods, right? So again, context is important. Regarding culture, I feel like if we speak to people who are or who have ingrained cultural relationships with meat, I think it's much easier if we say it like, you know, you can just eat one day without meat a week, right? And there are some studies that show even substituting this 1 day have significant impact on greenhouse gas emissions. But again, we're not only talking about, when you talk about environmental indicators, they're not only talking about greenhouse gas emissions. So there's also a lot of other trade-offs and other indicators to look at. But I would suggest when we go into behavior change, be relatable and contextual, and also going back to the idea of starting small. At least that's what we've learned over the past years in lower middle income countries like Indonesia. I hope that answers your question.
Thank you very much. Yes, your answers were very insightful and very complete. That was a quite insightful speech, and I thank you very much for it. Now to Ms. Hassan Tabar for the next keynote speaker. Thank you very much.
Thank you.
Thank you, Ms. Karen. It was really, really insightful. And it was shocking for all of us to understand how much the food sector has emissions in comparison to other sectors. And also to see food system as a health, as a very complex system rather than just, the final product. Thank you very much. And I would pass to Ms. Melvin Otino.
Thank you for having me.
Her presentation. Thank you.
So, Ms. Melvin Otieno, this is great to have you back. In previous panel, we benefited from your excellent moderation, so we're going to have you as one of our keynote speakers. I'm going to introduce you once more. Ms. Otieno is an assistant lecturer at School of Environmental Sciences and Natural Resource Management, University of Eldoret, Kenya. She's also PhD candidate in MLU, Germany, and she's also the founder of Planetary Health Eastern Africa Hub. We're going to host you with the topic of planetary health perspectives in Eastern Africa. So the floor is all yours.
Thank you so much for that wonderful introduction, and thanks you all for inviting me to this amazing conference today. I will share with you our planetary health perspective in Eastern Africa, how we've been able to promote planetary health in Eastern Africa and beyond, in order to learn from us so that you can try as much as possible, maybe to implement also at Tehran University as well as in Iran in general. So, sorry. Don't know, my slide is not moving. Is it moving from your end?
Unfortunately not, and we do not have your screen either.
Okay, let me share again. Sorry for that.
That's fine. Take your time.
Able to see my screen now? Sorry for that.
That's okay. That's nothing. Don't bother yourself. Now we're
Okay.
going to have your screen. That's okay. If you want, you change the slides to see that if it is freeze or not.
Okay, thank you so much. I hope it's
You're
visible. So I will continue. I'll talk to you about planetary health in the African context and share how the Planetary Health Eastern Africa Hub has been able to promote planetary health in the region. So as we all know from our previous speakers, they've already talked mostly about how climate change is real and it's already happening. And we see, for instance, in the African setting, there is also a lot of climate change situation happening as far as flooding, drought, and heat wave is concerned. And there is also a growing recognition throughout Africa that the effects of climate change are unavoidable. And this is also applied to other countries in the global south. So you find out that in Africa setting, this transformation is also putting the poor or the vulnerable populations in threat more than ever. And therefore there is the ability to adapt to these challenges is critical. And we find out that in most cases, for instance, communities in Eastern Africa really rely heavily on the agriculture and also the land for agriculture, and also rely for rivers and other natural system or ecosystem like the lakes for food consumption. Especially there's the Lake Victoria Basin, one of the largest lake where they consume a lot of fish. And there is also the topic of nutrition really catching up with that. And just to highlight, there is also need to prioritize planetary health in that we see in African setting, there is lack of knowledge on this topic, though especially among the communities and also among other disciplines. For instance, we've seen that only in public health practitioners are the ones who are really aware about these issues. But in most cases, if we want to promote really more on planetary health, we need to synergize other disciplines as well. So within the Eastern Africa Hub, we've really tried as much as possible to incorporate and work closely with other disciplines as well. So according to the IPCC report, it shows that there were increased number of total people who are affected by climate change hazards across Africa since 2010 to 2020. And they've really been affected by floods, tropical cyclones, heat waves, and also the storms and also the droughts, which has really been immense. And you find out that majority of these communities are really women and children. And at the same time, mental situation has really occurred, especially women are suffering mental illnesses, as well as the youth are also suffering this mental health problem as a result of climate change. And this is just to show you how much more female are really affected by the climate change impacts on health as compared to the male. If you can see from the screen, the orange shows how much number of women are really affected. It means that they're the highest affected people in the society. And you find out that at the same time, they bear the burden of taking care of their family members and all. And at the same time, we find out that they're really less recognized at the decision-making table. And we have less research being done under the topic of women and gender, which is really critical. So I'll urge maybe within our institutions to do more projects that focuses more on also women and climate change health. So aside from that, we cannot talk about climate change without talking about the Climate Change Fund, because we see that climate-related research on Africa has received a very small percentage of around 4%. This is according to the data of the Global Climate Change Research Fund. So you find out as a percentage of all the research funding allocated to a region, you find out climate research has really been minimal since 2010. And you find out that the major funders have been UK, the European Union, the United States of America, Germany, and Sweden. And you find out that also the most funding for the climate-related research on Africa, for instance, flows to institutions based in Europe and the US. So you find out that they are also mainly mainstreamed through the government organizations, also with private philanthropy. So this is something that is critical. And we find out that in most cases, the funding really focuses mostly on the food systems, ecosystems, and maybe the fresh water. While we see that the topic, when we talk about climate change, we are forgetting about the health aspect in it. And we see that there is also the issue of poverty, security, and conflict, and also urban areas, because we see that in Africa setting, a majority of the population is increasing due to urbanization. And you find out also when we talk about climate change situation and adaptation, we see that research on climate change adaptation received only 17% of the funding impacts yearly. So you find out that this is really low, and we cannot move forward without getting support from different entities to push forward for adaptation and mitigation plans. So besides us talking about more of the problems and all that, it's high time for us to really focus more on the solution and see what are some of the opportunities do we have. For instance, in Africa, one of the planetary health opportunities that we have, we have, given the Africa demographic profile, you find out that the youth represent the best opportunity for the future, because you find we have a young population of around 75%. And you find out that being a young-led continent, of majority being the youths, you find out that if they can be motivated and be inspired to contribute to the present and the future solution, that will be really incredible. That's why we really need to empower more youths in planetary health. And through the Planetary Health Alliance, our main organization that is based in the US, we have the Planetary Health Campus Ambassador Program, where one of my colleagues here who will talk more about it in his presentation tomorrow. But just to highlight that this is a prestige opportunity for students at university level, especially the undergraduate and postgraduate, to take leadership in planetary health. So I'll just highlight later some of the examples of activities that these campus ambassadors do. Aside from that, other planetary health opportunity that we have in Africa, when we talk about renewable energy, for example, we have the Sustainable Energy Fund for Africa. And this is a multi-donor special fund that is managed by the African Development Bank. And it provides a catalytic finance to unlock the private sector investment, as well as to renew the energy efficiency. And you find out that its first financial close was up to $40 million to invest for clean and modern cooking solutions in Africa. Because at the same time, when we talk about we talk about air pollution, we find out that majority of people who are suffering in the Africa setting are women, especially because some of them are still using the firewood for cooking, and they're being exposed to underlying issues like respiratory issues due to usage of firewood. So we need to also do more of research on clean cooking so that we can reduce air pollution. Aside from that, also there is under climate finance, there is also an opportunity where there was a project that was being done by the Africa Environment Health Pollution Management Program, where they were focusing to reduce exposure of mercury and other unintentional persistent organic pollutants and pollution. The case study was happening in Ghana, Kenya, Tanzania, and Zambia. So this was to enable them to strengthen the institutional capacity to manage and regulate mercury using the artisanal small-scale gold mining, because this is also a serious issue in some African countries. And this was a good project being done after being supported by the World Bank. Another great opportunity that I learned from a certain project in Uganda was on the usage of the local volcanic stoves that are gotten from the mountain of Kisoro in the western part of Uganda. And it uses only 15% of charcoal dust. So that means that at least they're trying to be sustainable and reduce the usage of charcoal in most cases. So you find out that the rocks, as from the picture shown, you can see that the rocks are really reusable up to around 8 months and can retain heat much more than other cooking fuels. So this is a good eco-friendly stove that is showcased there. So maybe other people in African setting and beyond who are still struggling to use the firewood would maybe learn from. And then another opportunity is talking on scaling up agroecology initiative in the West Africa, because I learned from this project that sustainable agriculture is also growing very fast in West Africa, and the transition is only gaining momentum. And you find out that over the recent years, countries like Senegal, Burkina Faso, Togo have adopted policies in support of agroecology. So you find out that it's good to learn from it, because this is a project that is focusing on the West Africa's biggest farmers organization, and also they're engaging in new ideas and involving more people into agroecology. So we could learn a lot from them as well. So just to highlight, why am I talking about the Planetary Health Eastern Africa Hub at this moment? It's just to share with you what are some of the actionable plan that we've done. This movement started or was initiated back in 2019 and officially launched in 2020. And I initiated it when I was still a campus ambassador back in 2019 as a student doing my master's thesis. And in the process, I wrote a theory of change of how could I promote planetary health, not only in my country, but also to include my region. So within the Planetary Health Alliance, they had the annual meeting happening, and they had an opportunity for us to create more of movements, regional movement for planetary health. And we have around 10 regional hubs across the globe. And Planetary Health Eastern Africa Hub being one of them, and we have another young one that started recently, the Planetary Health Western Africa Hub. And for us, our aim is to stimulate regional community building, provide education for transformative action, and also push forward for policy making in the face of our greatest time of emergency of our time. So you find out that we have been immensely supported by the German Alliance for Climate Change and Health, and also Women Leaders for Planetary Health in development of the multisectoral capacity building program, and also initiating the initial stages of establishing the hub. And we have a vision to have a region in which everyone prospers through the engagement and also empowerment to address climate change and planetary health issues regarding safeguarding human health and restoring the Earth's ecosystem for the upcoming generation. So basically, we are really committed to advance planetary health and One Health through research shedding light on the challenges and opportunity for achieving a healthier and sustainable Eastern Africa, and also promote education, collaboration in education, research, and policy initiatives. So one of the action point activities that we initiated back in 2020 after our launch, we worked closely with the Northern European Hub, which is currently European Hub. We initiated a joint COVID-19 resource platform where we were able to create this platform where experts and networks were able to learn from the shared resources, especially during the pandemic, because there were myths and misconceptions about COVID-19, and we were able to really push forward for good communication as concerning COVID-19. Aside from that, we've also collaborated with the German Alliance for Climate Change, CLUG, where we've really learned a lot from them, especially with benchmark planetary health education, because they have a planetary health academy where they've been offering planetary health education within their region and beyond. So we were able to strengthen the Eastern Africa activities through we were able to strengthen the planetary health education activities through working closely with them, and we had a short project supported by the DAD. Aside from that, we started off our activities by involving our community members to our lecture series and interactive workshops, where we were able to, or honored to have guest speakers from the founder, as in the director of Planetary Health Alliance, the Planetary Health Alliance director, Dr. Sam Meyers, who has really been our supporter and is also currently our scientific advisory board member for our Sophia project. And we've also been worked closely with the president of CLUG, that is the German Alliance for Climate Change, Dr. Martin Hermann, and also the founder of Women Leaders for Planetary Health, and also some amazing research experts from the African side who have worked closely with us. So aside from that, we've also pushed forward for youth leadership in planetary health. As I mentioned earlier, we have the Planetary Health Campus Ambassadors, where they have an opportunity to form planetary health clubs in their institutions. And I think this is also a good opportunity for your institution in Iran to support the students to apply for planetary health campus ambassador position, because we already have an opening, so that they can form a planetary health club and also initiate some activities that will push forward for planetary health education and other related topics. And aside from that, These are just some of the youth leaders in Africa, though the numbers increased, and my colleague will expand more in details tomorrow concerning the global coverage of the campus ambassador. Aside from that, these are some of the activities that the Kenyan campus ambassadors have already done. They have done a lot more on role of green spaces, mental health activities, and also sustainability and cleanup activities, and also doing more of the lecture series and workshops, and inviting us to contribute to their activities. And also we have our amazing network also in Tanzania through our ongoing project, Sophia, where we work closely with them. They also initiated a club at Tanzania at KUAS University, where they're also trying to work closely with the community of the Lake Victoria Basin. And also, when we talk about this, we've tried to strengthen more of the research and collaboration on One Health and Planetary Health. So you find out that through this, we've been able to have organize scientific virtual workshop or hybrid workshops, where I invite researchers from different institutions and also organizations from local representation, so that they can share the projects that they're doing, so that we synergize more of working in silos and embed opportunities for collaboration. This is just one example of a project that through the networks we initiated. We had a project on the role of wet markets and backyard livestock in supporting nutrition for preschool age children in Kenya, challenges from COVID-19 influence closure. This was in partnership with Royal Holloway University in London, and also in partnership with the University of Eldoret. So this is just one example of synergizing the networks that we have to promote more of research, aligning One Health and Planetary Health. Aside from that, also, we've really done more of the advanced course on health and climate change through the participation in the advanced course on health and climate change in Munich, where my earlier colleague, Given Monga, is working closely with. And through participation in this advanced course, we're able to have some of our students, especially the postgraduate students, join this course. And throughout this course, that's when I was able also to meet one of our partners from Würzburg. I'll talk more about our project, where we were able to write this Sophia project through this kind of advanced course. So it is really relevant for us to network a lot, and you never know who will want to work closely with you, so that you can build you can advance planetary health. Aside from that, normally we attend international and regional conferences. This is just an example of a hybrid conference that we attended for the Planetary Health Annual Meeting in 2021. We've been privileged to attend the World Health Summit. We've attended the COPs and all that. And also recently, we even attended the Africa Public Health Student Summit in Nigeria, where we had an opportunity to co-organize this event. And it was really amazing to see how the youths are really empowered in tackling climate change and pushing forward for change. So this was a great opportunity for us to promote more planetary health and planetary health education in this region, in the West Africa region. Aside from that, we are also really pushing forward for encouraging community engagement. This is just an example of an outreach activity that was led by one of our students, who is currently the Next Generation Fellow for Planetary Health. And it was focusing on the Marura wetland. This is in Eldoret, Kenya, where they were trying to discuss more of the transformational concepts of planetary health on how to sustainably utilize and manage wetlands, and the role of including the communities. Aside from that, we are also trying as much as possible to leverage the network with the indigenous communities so that they can share their ideas and how they're trying to adapt to climate change. We even did a documentary together with them and together with the Maasai community in Kenya, who are really affected by drought as well. So we were able to do a documentary on how to communicate the impacts of climate change. And there is really power in engaging communities and including the indigenous voices. especially by synergizing levels of academics and also involving other disciplines as well. So without further ado, I would like also to really emphasize more on the planetary health education. But under this, there is need for us to learn that from the new health paradigm requires a new approach to the medical education based on the cross-cutting principle. So for our case, we've really tried as much as possible, not only to integrate planetary health to public health specialists, but also to involve the healthcare professionals, especially the medicals. So you find out that planetary health also includes the indigenous perspective and the core knowledge, values, and practices that are needed to be incorporated into the education for sustainable healthcare. And you find out that the Global South can lead the way on incorporating this approach to the medical education. So just to highlight for you how planetary health education in practice looks like in Eastern Africa, we started off by doing a pilot consultative meeting with several institutions, several universities in Eastern Africa. And as at now, we were able to embed climate change and planetary health as an elective course in the University of Zambia and also University of Eldoret, and also other universities in Kenya. But it is a slow pace because, you know, there is a lot of bureaucracy at university level, especially when they want to be, as in like when you share a new idea, sometimes it's difficult to really influence the university itself. But the best strategy is also to start with the department that you are. So for instance, for me, I started influencing our Department of Environmental Science. And in the process, we used to invite them in these activities to share their project ideas and all, and involve them in workshops and also piloting. And in the process, they were able to accept planetary health to be a unit for the postgraduate students. Also, this is how it looks like for the medical education. We were able to have an opportunity to partner with the Daktari Online. This is a network of medical professionals across Kenya, and they also have a network of other international and regional network focusing on the medical, with a medical background. So we were able to introduce climate change and health or planetary health into their space. And we were also able to integrate planetary health in the medical education through the Kenya Medical Association, who are really pushing forward for this. And this is just as a result of that collaboration and contributing towards their work, we were able to influence around 1,800 participants who were able to register, and these were included the clinical officers, psychotherapists, it included pharmaceutical technologists, the nurses, and the interns and the students. And right now they're doing these activities on their own, but we were able to contribute to support them. So just to amplify what the Eastern Africa Hub has been doing as a whole, we were privileged to have a 4-year project that is in partnership with the Julius Max Miller University in Würzburg, Germany, where my colleague initially was supposed to join to talk to you more about planetary health education, but she was sick. So she's the lead for this project, and also in partnership with my university, the University of Eldoret, Kenya, where I'm the coordinator there, and also Catholic University of Health and Allied Sciences. So for us, we really wanted to strengthen more of the education, research and collaboration, community outreach, and student exchange. So the SOPHIA project really brings together international expertise to strengthen education, research and academic collaboration, and also the scientific exchange on planetary health in Africa. And also we aim at exploring and investigating and also teaching and acting on the increased climate and environmental changes and their interactions with health. So to just give you some of the major highlights, one of our successes in the last 3 years of having this project, we have had SOPHIA Planetary Health Toolbox launched, And we've always been collectivizing resources within our network so that if anybody who wants to integrate planetary health into their educational curriculum can use the resources that are available within our toolbox. And we have several thematic areas under planetary health that we focus on that is really relevant. And we've really benchmarked also from the global planetary health education framework, what were the needs and all that. And we've also pushed forward to have offered didactic skills training, which we did early this year, which will help the educators or learners to really know how to apply the skills when teaching planetary health. Because when you teach about planetary health, it's not just more of the theory part, but how can you utilize it to move from knowledge to action? Like how can you work closely with other people in other sectors, and how can you involve your community in it to strengthen more of promotion of planetary health? Aside from that, one of our successes is we've had each year we always offer Sophia WHOA's annual international conference at Catholic University of Health Allied Sciences. And basically this is an opportunity for us to really introduce planetary health in the Eastern Africa communities in Tanzania, especially through the conference. So as you can see, in 2022, we were able to present 2 topics. And in 2023, we covered around 16 topics of planetary health. And this year, we were able to cover around 18 planetary health topics. So it will be a good opportunity if you can also engage into our upcoming conference for next year. And we'll be excited to have your shared stories and what you've worked on, especially in line with research. Aside from that, under Sophia, one of the successes is the introduction of the climate fresk. This is a science-based tool used to as a workshop for 3 to 4 hours to help participants understand the cause and the consequences of climate change, and can be an impactful tool for providing quality climate education. So this can be also a useful tool to be used amongst your students, communities, and also in the work areas. So we really learned about this through the summer school program that we normally have each year. So we were able to apply it also to our African setting. So this was done in Tanzania, and recently we also completed this climate fresk education also at our institution in University of Eldoret. Aside from that, we've also done 3 successful summer school program in Würzburg here in Germany, where we involve students to share their case study project ideas, and also we also synergize communication tools for planetary health. How can we use creative arts to communicate planetary health in different settings? So we've educated them more on that, and we introduced the climate fresk as well. And in most cases, they also are taught on how to connect with nature. And also we've been inviting experts or international speakers from within our networks to contribute towards our summer school program. And this has been also a success. And also we've tried to educate our participants on planetary health diet and all. And we were also privileged to have Baha being one of our participants this year. And now this is now the journey that began through the summer school on how can she also contribute in her own community. And that's how we ended up here in this amazing conference today. So thanks to this, the Sophia initiative from our partners, we've really influenced a lot of people, not only people in Iran, but also people from other regions. So aside from that, we were also privileged to be invited by the DAD themselves in the Project Leader Conference in Tanzania that happened this year, and we were able to learn from other projects that were presented from other networks. At the same time, we were able to present more about our Sophia project, and we had a very candid discussion on how we can engage more on planetary health education and improve more of the SDG goals. So just to almost finalize, I would also like to share the Eastern Africa Hub has not only worked closely on the work of education and implementation, but we're also trying as much as possible to push forward for policy. So we've also been honored to just complete our recent project on public health operations for climate action that is phonic, that is supported by GLORA. And this is in partnership with our hub and also the Center for Planetary Health Policy in Germany, as well as Ludwig University of Munich in Germany. So we realized that within this project, we realized that there was no framework available to assist decision makers in determining the most relevant public health functions for climate action. So during the time of our project, we were able to conduct a scoping review on existing public health functions by the public health institution addressing climate change adaptation and mitigation. And we are trying to develop a tool with tangible indicators based on the newly published WHO framework, because the WHO framework only showed the broader overview, but we were able to narrow down to identify existing good practice examples and also pilot the tool in Germany and Kenya in collaboration with the project partners. So this is our ongoing project that we just completed, but we are working on policy briefs as well as we will be able to share our research finding in the next coming year through publication. So just to conclude my presentation, I would like to say that the Planetary Health Eastern Africa Hub has increased visibility and has shown positive impact in the last 4 years. And this has been led by the ongoing collaboration with the German Alliance for Climate Change, as well as other institutions in Germany and also global institutions. So it means that a bilateral North-South learning partnership could be established so that together we will achieve the great transition for a just transformation world that optimizes the health and the well-being of all the people on the planet. And we really need to see that there's need to amplify and bring voices of African and other global South members in support of the most vulnerable groups. And also we need to really push forward for planetary health education and research, especially integrating it into the medical curriculum. And we see that there is, beside an active Eastern Africa planetary health community, new networks have also opened up with other hubs, like the Western Africa hub are also doing a lot of amazing work at the moment within their region. And having said that, these are just some of the useful articles that we published recently. And I would like to echo that to build a healthy future for people on the planet, we need to redesign existing decision-making structures to ensure that the representation of communities they serve are remarkable. And I would also like to welcome you to join and become part of the main Planetary Health Alliance, to become a member, and also encourage your students to register and be campus ambassador by applying. And also the Planetary Health Alliance will be hosting their annual Planetary Health meeting for 2025 in Rotterdam in Netherlands. A call for abstract application will be announced soon, I think early January. So look out for that. Thank you so much for listening. And I'm open for further questions.
Thanks a lot for your very, very, very informative and comprehensive and innovative speech. What you've done, the number of projects was really captivating. Thanks a lot. So I would like to ask Dr. Ivan Munga to summarize the panel 5, and I would like to introduce him once more, because once we had him as a speaker, I'm going to introduce him again. So he's a PhD research fellow in LMU, Germany, and also policy advisor at the Planetary Health Eastern Africa Hub. So the floor is all yours. Please have an overview of what we had in panel 5. Thanks a lot.
Thank you so much. Probably before I talk about the session that we had in panel 5, let me say well done to each one of you for having been here with us until the very end, the last session for today. And thanks to Melvin, and thanks to the earlier speakers who have shared various insights. I think in terms of maybe the take home, to summarize what we have looked at, especially in the last section of today, I think we have looked at really practical areas where we can get engaged to make a difference within our profession. And we have looked at various aspects within this realm, whether it be the actual role that nurses play and microbial resistance, or looking at NCDs and what we could do around that, or whether it's around localizing food systems and all. I think what we really see across this panel session that we had is an empowerment to each one of us in terms of what can we do. And this is the beauty of planetary health aspects, because then in the end, we get down to this very angle of looking at things to say, what can we contribute within the sphere? So we can look at this from a professional angle, whether we learn from the examples from East Africa, how different people get engaged within the medical school training in various angles, but asking the question, what can be our contribution, as it were? And I think this is very, very critical as we close today, in fact, that then we get to this point of not just knowledge, but also having the desire to make a difference. And we ask to say, what can we do? What can we improve? Where can we start from? What are the areas that we can get engaged? What could we do? What are the initiatives that we could do? Thanks to the organizers of this conference, for example, because this is the first of its own kind. This is also a possibility of what we can do to begin the conversation, as it were. And so I leave you with this kind of impression as we close the day for our conference, and also the last session rather, for the conference, that we get to a point of action, asking ourselves, what can we do? And also begin to move from knowledge to action. I think that's the core that we see, with also the very specific case studies, examples that have been shared from the Eastern African perspective. So let's continue brainstorming and seeing what can we do beyond even the conference, so that the movement starts here and we go forward. Ladies and gentlemen, thanks a lot for the conversations and the space that we have shared today. Thank you very much.
Thank you very much, Dr. Munga. In the end of this program for today, we'll have an overview of the topics that we talked about. And I thank you all that stayed this long with us. It was a very, very nice program, and it was very informative. I'm sure that everybody who attended in this program learned a lot of things, and it was very insightful for all of us. Thank you. So today, after welcoming our dear guests, we talked about planetary health and the megatrends affecting planetary health. After that, we had an introduction to planetary health, and then we talked planetary health education for health professionals, which are the cornerstone and the backbone of our healthcare systems. Infectious diseases, emerging threats in planetary health, and we talked about how these infectious diseases can be connected to planetary health. Then integrating climate change, sustainability, and planetary health into nursing and midwifery education, which can be a way to understand how our future researchers will be. After that, we talked about strategies for adapting and mitigating climate change using En-ROADS tool, which was a tool that Dr. Farhad Buluri introduced to us. After that, we talked about understanding climate-induced disasters and how these disasters can affect our lives, and how can they impact our work as healthcare workers. Then we talked about Chance Network, building collaborative networks in Africa, which Dr. Caroline Mutani spoke about, and it was a program that they ran in Africa. And then we talked about the role of nursing and midwifery students as health ambassadors in thriving 4-chamber symphonic belief and practice of self-regulation in home visits to create a healthy environment by Professor Traghi, which we were very honored to have him here. And From Words to Impact, Driving Planetary Health Through Communication by Dr. Salina Schlund. And after that, we talked about transforming food health systems and policy development in planetary health by Dr. Giva Munga, which we were honored to summarize the FIPS panel for us. And we had summary and keynotes of that panel by Dr. Otieno. I'm sorry if I forgot to mention other names. The papers were a little scrambled and I couldn't find all of your names. Thank you a lot, and we were honored to have you here. See you tomorrow.